You know, artificial intelligence is making its way into exam rooms, not to diagnose patients, but rather to help doctors spend less time taking notes and more time caring for them. Austin Regional Clinic has rolled out an AI-powered ambient listening platform across all 40 of its Central Texas clinics. Dr. Manish Nayak is the Chief Medical Officer for ARC. He joins us now to talk more about this. Thanks for joining us, Dr. Nayak.
Thank you. Pleasure to be here.
So let's dive right into it. First off, tell us a little bit about this platform, the ambient listening, and how it's being used day to day in exam rooms.
We're using the platform basically to record the conversation and take notes during your visit. As everyone knows, when you go to see your doctor or your APC or your nurse practitioner, they're often taking notes on a computer. So you have a computer and a keyboard between you and your clinician. And this technology essentially allows your clinician to focus on you, to focus on the patient. And meanwhile, in the background, this ambient technology is capturing detailed notes about the visit, about your history, about your examination, about the plan for treatment. So it really takes technology from being an interference in the exam room between you and your patient to now essentially taking that workload off of the clinician so the clinician can focus on you, the patient.
So this is to save time. So how much time is this platform saving doctors? What are the numbers that you're seeing?
So we're seeing almost a 18–19% reduction in time spent doing notes. And we're also seeing that the accuracy of the notes has improved. It can, sometimes you're reviewing a lot of information in a visit, and as a result of the technology, you can capture a lot more detail and capture it accurately.
You know, one of the big concerns that we thought about as we were considering is the security. How is this platform protecting patients' private information? And is it listening when the clinician leaves the exam room?
It's an excellent question. And security is one of the things that was of highest priority for us when we looked at using any of these technologies. So the good news is the clinician turns on and turns off the device when they enter the exam room. So in fact, if you decide at some point during the examination you don't want to use that ambient listening tool, it can be easily turned off during part of the visit. The good news is we've evaluated the platform exhaustively. So, this data, your protected health information, is not going to the public web. The recordings are not being saved. They're being deleted. And none of the data, none of your data, none of Austin Regional Clinic's data is being used to train the AI model. So we recognize the importance of that security and the security of your own health information. So that's how we handle that issue.
And another question on behalf of the patients. Do patients know that this technology is being used? Is that something they're told up front?
Oh, absolutely. We want every patient to know we're using it. And for two reasons. One is we want patients to accept that we're using this technology. But the other is this technology actually takes notes for you at the visit. So many patients that I see will come in and they'll want to take notes about their visit. It's very hard to remember all the information you heard at a doctor's visit or a clinician visit, but these notes are actually available to patients as well after the visit. So not only does it take notes on the encounter, but it gives a really nice detailed game plan on the plan after the visit. So patients have access to that.
And that's beneficial for them. What feedback are you hearing from other doctors who are using this technology?
So doctors, many of them have told me this is a game changer. This has returned some of the joy of medicine to practice because many people have probably heard clinicians often are dealing with lots of administrative burden in today's world, dealing with insurance companies, dealing with filling out forms. And this is one step towards taking some of that administrative burden off of clinicians and returning the joy of medicine. So our doctors are very happy to use this technology, and we're happy to be able to implement it. Yeah.
Another instance where the future is now. Dr. Manish Nayak, thank you for being here with us from the Austin Regional Clinic. We appreciate your time today.
My pleasure. Thank you.
Thank you.